Barbara's in because there's a lot of medical news going on, and some of it, well, it's not lunchtime yet, but we'll get to it. It's explosive diarrhea one coming up.
Yeah.
Let's begin with the smoke in the air. There's a warning out today. What is it?
Yeah, because it's unhealthy air. Yesterday, it was unhealthy for certain groups of people with asthma, heart disease. I have asthma, so not good for me. Today, it is bad for everyone. It is in the unhealthy zone for anyone out there watching this, which means our lungs are the ones that kind of, filter through all of this. That gets stuck in there. A lot of people are getting pneumonia.
So if you're compromised, by the way, this is the wildfires in Canada are sending the smoky haze down to us. We had it, this is the third day in a row.
Yeah.
If you're immunocompromised or you have underlying lung conditions, this is a dangerous day to go out. Are we telling people that?
We are. I did a whole story on it yesterday. It's a dangerous day for people who are immunocompromised. Yeah. It's a dangerous day for you, Gene.
Should I not go home in my convertible? Put the top up, put the air conditioner? What should I do, Barbara?
Well, according to Jason Doris, between 3 p.m. and 3 a.m. is going to be the worst. So when you come back to work later today, I would have your top up.
All right, I'll take your advice.
Just some good advice.
Now, listen, Taco Bell is in the news for the wrong reasons. The lettuce, the tomatoes, a few other fresh veggies, they're pulling them from certain locations because concerned about this explosive diarrhea, a parasite. What's the latest? Yeah,
so cyclospora, what they're finding is they're tracing it back to lettuce or some fruits or vegetables. The thing of it is this parasite can get into the groundwater, can get into the dirt. They're trying to trace it, and this parasite sticks to to the lettuce. Yeah. It's hard to wash it off.
Well, that's what I'm saying. They don't wash the lettuce, but it might be that they're washing the lettuce. It's just impossible to get this thing off.
It's impossible to get it off. And so even some people, and I'm doing a story on it tonight, are going so far as to say avoid fresh produce, which we preach that you should be eating fresh produce.
If you pick this up, and look, it's making the headlines because of the term explosive diarrhea.
Yes.
The truth is, it's no joke because you have it for weeks, and you could be what's the term when you don't have enough water in you?
Dehydrated.
Dehydrated, right?
So what happens is they can treat this with an antibiotic, and it's an effective one, but you're still going to have explosive diarrhea for weeks, no matter what. Now, if you're one of the unfortunate people who cannot tolerate this antibiotic, you could have it for months.
Ooh. Well, the story's blowing up, Barbara.
Well,
yeah. All right.
Good choice of words there.
One more. Every day I come in, I see you. You're at your desk. You've been following this Alzheimer's conference in London.
Yes.
Is news coming out of it?
There's so much. This is so exciting. Dan Janik and I talk about this because we have a strong family history of Alzheimer's, so we want a cure right now. But a lot of it boils down to lifestyle changes, intense lifestyle changes. What they did in this country was the U.S. Pointer Study. People signed up. Some were in the group where it was intense lifestyle changes, eating healthier, working out. The others were told, just do it. Well, the people who had the more hands-on, they improved their memory. So what they did was, because 66% of people with dementia are in underdeveloped countries, they did a study in Latin America. 12 countries, including Bolivia, they did Brazil, Mexico. And what they did, is this going to work in the Latin American peoples? And they did the integrated salsa, a diet like the Mediterranean diet, but based on, a Latin-based diet.
So there's more evidence that Alzheimer's, it may be diet related, and if you switch to a healthy diet and exercise, you may ward off your risk.
Huge. Now, I've also got to tell you a couple other things they did. They developed a blood test. That really isn't new. What was new was they had primary care doctors do this blood test in their office, because by the time you have memory loss, you're going to see a specialist and getting diagnosed.
Right.
This blood test can diagnose you 10 years earlier. So they did this blood test in 1,300 people. And what they found was a 93% accuracy rate in diagnosing Alzheimer's correctly, compared to 94% if you're going to a specialist.
All right, by now we know Alzheimer's, it's called an amyloid plaque. correct?
It's
on
amyloid
your
and
brain.
tau. So there are two proteins that are responsible: tau, T-A-U, and amyloid protein buildup.
It builds up on your brain. Are there any drugs? What's in the pipeline to break those up, make them go away?
Well, they are working on an anti-tau medication.
Yep.
So they're always working on those. But something I find very interesting is one we're just starting to embark on, using a GLP-1, an
Okay,
anti-inflammatory. Think about it. It's an inflammatory condition. So a GLP-1 in
That's the weight loss miracle.
This-
Vitamin
yes.
Z, my doctor calls it. Vitamin Z, Wegovy, Zepbound, all of them. Mounjaro.
But not just using the GLP-1, but adding on the intensive lifestyle changes. They think that combination could be golden.
So, recapping, diet related. Switch to a healthy diet. You'll be good for a lot of reasons. to do that.
Exercise, yes.
Regularly exercise. There are drugs in the pipeline.
There are drugs currently available and drugs in the pipeline.
Okay, before I let you go, 30 seconds on Lindsey Graham. He had a tear in his aorta.
Aortic dissection.
I know people that has happened to. They didn't make it, but it happens very fast. So if you look at what happened to Lindsey Graham, I know the internet is full of conspiracy theories. He was in Ukraine and came back, maybe he was poisoned. What happened to him is classic what has happened.
It is
when you get
classic.
this.
It's like a sandwich, your aorta. So what happens is it splits apart.
Yeah.
You can actually feel it split apart. And I believe he talked about that in a phone call he had with somebody. But it splits apart, and literally 50% of people who have it don't even make it to the hospital alive.
You don't make it. All right, Barbara, thanks. I'll see you on the news tonight.
Okay.
What do you got coming up, by the way? Is your Alzheimer's story tonight?
Cyclospora. We're gonna
More explosive diarrhea.
more
Just
explosive
in time for dinner at
stories.
6 o'clock. All right, Barbara, thanks.